Okay, good evening, everyone. So, because Clotilde is, we knew she was going to be virtual. We have three of our five here, so we're just going to get started. And once again, thank you for your patience, and welcome to the Health and Environment Committee meeting. Um, I will have a couple of additions to the agenda. I know that Dr. Maritzi wanted to introduce something on the bio bus. I didn't have time I have it on my agenda, but I didn't have time to research, to circulate a new agenda. At any rate, she asked to speak on new additions with the bio bus. And I have Tiffany Kahn who requested something on pesticides, and maybe I can bring that up as We Act completes its presentation. I know theirs will be short. Um, I'm going to come to the minutes at the end because we don't have them all together now at any rate. So let me just go straight to We Act for Environmental Justice. And I thank you both so much, Cameron Clark and Caleb Smith, for participating in our meeting. We have, of course, more online at this point than we have, present inside with our committee. But that happens from time to time. So if you don't mind, can we start with Cameron? And Cameron, introduce yourself. And I already said We Act, but what you do with We Act, and bring us up to date because you did a wonderful, wonderful presentation to us. I believe it was last month's meeting, if not the May meeting, it was April. And then he will be followed by my new friend at We Act, Caleb Smith, who is involved with Rainproof NYC, and he will talk to you about that and introduce himself and what he does at We Act. And then in between there, I talked to Caleb about the spraying of pesticides and the concern we have with that. So hopefully we need to, at the end, I can bring up something and see how that fits in. Thank you. Thank you. Good evening. Good evening. I'll sign in there. I love your arm. Thank you. I love you. Good morning in progress.
Thanks, Lakita.
Nice.
How's it going, everybody? My name is Cameron Clark. I'm an environmental justice fellow with We Act. I'm a medical student at Columbia University, and I'm taking time off to work with We Act on primarily asthma policy issues. I just was invited to come to speak today about the New York Heat Act. And so essentially what that is that's a bill that we have been pushing at the state level that would, implement a few things. It would essentially take all of the money that we're currently using to subsidize Con Edison's natural gas expansion and would allow us to channel that money into investing in renewable energy and community energy for our community. And it would also create a cap so that no one is paying an exorbitant amount of their household income on their utility bills. So, just an update on that bill. Unfortunately, we didn't get it passed in the budget, but as many of you are probably already aware, just because we didn't get it passed in the budget doesn't mean that all hope is lost. So conversations are actually still ongoing. This is the last week of the New York State legislative session. So it's currently being negotiated between, the Assembly Speaker Carl Hastie and Governor Hochul, and it was actually already passed through the state Senate. So we're hoping that in this last week we can get Assembly Speaker Hastie to shepherd this across the finish line. It's already got majority support in the Assembly. So
Oh,
what
did he freeze?
what we've been doing over the past couple of weeks is we've actually been flyering in Central Harlem, in East Harlem, and in Inwood. in the districts of some of our assembly members, Eddie Gibbs, Al Taylor, Manny De Los Santos. These assembly members are actually already co-sponsors on the bill. What we're doing is we're just trying to get out the word to their constituents to encourage them to continue to make this a priority in their conversations with Carl Hastie. So if you see us out in East Harlem, out in Central Harlem, out uptown, please say hi, come. We're always friendly, and please feel free and feel encouraged to call your assembly member and ask them to talk to Carl Hastie about the New York Heat bill. What we're actually going to do is I'm going to drop a few things in the chat that are actions that folks can take. So actually today we have a call relay that we've set up in cooperation with New York Renews. And essentially, if you sign up for this call relay, we'll direct you to a website where you can leave a message for Speaker Hastie, for Governor Hochul, and your local assembly member demanding that we get New York Heat across the finish line. We also have, a Twitter storm that we're currently running. So if you're on social media, please, make a post, tag Carl Hastie and your assembly member, and use the hashtag New York Heat. And then finally, like I mentioned, we're continuing to flyer. So if you want to join a flyering action, we're always looking for volunteers to help us flyer and help us talk about, how important this bill is. So we have, a little bit of information on how you can get involved on some of those flyering actions that we've got going on.
And Cameron, let me just break for a second. And I missed some things with some of the activity going on
Yeah,
here. But just it passed in the Senate.
Yes.
And so it now goes to the Assembly for, what is it, September?
So we're actually in the final week of the legislative session. So what we're trying to do is we're trying to get it passed this week. So it has
in the Assembly.
I'm sorry? In the Assembly.
In the Assembly.
That's correct, yeah.
Okay.
So we have, it's passed.
And just, okay, and just the highlight, give 2 or 3 highlights briefly of the New York Heat legislation.
Absolutely. So this would take the money that this is taxpayer money that is currently going to Con Edison, just so that they can expand their gas infrastructure and make gas more entrenched in our communities. That's, polluting, it's unhealthy, it's risky, it's unsafe, it contributes to climate change. And it would allow us to channel that money and invest it in community-based renewable energy projects like solar, like wind, like geothermal, that are much more affordable and renewable for our communities. And then additionally, what it would do is, and this is the part that gets people excited, is that it would also cap the utility costs that you're actually paying to your local utility. So nobody would be paying more than 6% of their household income in utility costs. So this is super, super impactful, particularly for like low and middle income people who are spending a lot just on their utilities.
And was there something where Governor Hochul ended up being favorably disposed to this?
Yeah, so,
I read something like that because it was a question before.
Yeah, when we were trying to get this passed through the budget, the Senate was completely on board with essentially all provisions of the act, and Governor Hochul was, a little bit concerned about some of those affordability provisions. But what we're expecting is that right now at this stage, the main person that's standing in the way of this getting passed is Carl Hastie, and that's because Carl Hastie is really interested in keeping sort of the Democratic supermajority in the Assembly, and he's hearing from some of those upstate Democratic, quote unquote, Democratic representatives in Buffalo and in Rochester that are really being paid by fossil fuels to oppose this, that if he passes New York Heat, that they're going to be concerned about getting reelected. So what we need to do is make the point to Carl Hastie that we can't, mortgage our future based on, the reelection prospects of these people who are bought off by these fossil fuel companies. It's more important to, actually do something that benefits people, at the state level.
If you send an update on New York Heat tonight, I will circulate it to our committee and some of the others who are on the mailing, okay?
Absolutely.
If
I
you have
just
an update tonight, because you have a limited, well, I guess we have a limited amount of time to have impact since
for
you're
sure.
looking to pass it in the legislature.
Yeah, I
I
think
mean, in the assembly.
I just sent you an email with just like our call to action. So if feel free to circulate that. That would be great.
Okay. And Cameron, are you saying something about the tree planting?
I am not. Is Caleb is are you potentially?
Okay. Does we
Um,
have anything in particular in terms of encouraging tree planting?
so I can talk about that a little bit in my presentation, but there's actually more on that at
Okay.
an
Okay.
event tomorrow that we're hosting, so I can share that later.
Okay. All right. So if we let's hear from Caleb, and then if there's questions for either one, we'll take them. Okay, Caleb. Uh, I met Caleb at a Rainproof NYC session, and I wanted he gave a wonderful presentation, and so we'll hear part of that now. Just an update on what's happening with Rainproof NYC.
Hi, everyone. So my name is Caleb Smith. I'm the resiliency coordinator at We Act for Environmental Justice. I use they, them pronouns, and I'm on the New York policy team. So just to give a little background, Rainproof NYC is sort of a new stakeholder engagement process that the city is leading in coordination with several different agencies within the city, along with Rebuild by Design, Regional Planning Association, um, One Architecture and Urbanism, and the lead uh, departments within the city that are a part of this process are the Mayor's Office of Climate and Environmental Justice, the Department of Environmental Protection, and the Mayor's Office of Housing Recovery Operations. And so basically what Rainproof does is it's seeking a lot of feedback in the design of solutions to and adaptation strategies for heavy rainfall events. And so we're organized in three working groups to get this task done. And it's a pretty large group of organizations and some uh, independent individuals that are in this process. So there's representation across all five boroughs, 12 neighborhood organizations, 21 city, state, or federal nonprofits, and 14 city agencies, one state and one federal agency, plus uh, at least 10 academic, private, or philanthropy organizations. And the working groups are focused on managing rainfall. So that's the working group I'm in. Our task is primarily around how we want to see the city integrate nature-based uh, solutions to managing stormwaters, in addition to interventions that we can make in our stormwater infrastructure. So that includes the sewer system and uh, other parts of the public right of way, and sort of engaging both private residents, building owners, um, utilities, um, and figuring out how we, one, communicate flood risk, and how everyone is sort of given the resources to reduce their flood vulnerability. Then there's also the Housing Mobility Working Group, which is focused on more coastal communities because this process is working to kind of address various different kinds of flooding, but particularly there's some parts of New York where they're subject to cloudburst events, sea level rise, and or river flooding. So when all of those things compound, uh, there are some areas that are so flood prone that the city can offer residents uh, a buyout, essentially saying that this space is so flood prone, there's not a way to use infrastructure and other strategies to prevent it from flooding. And so that group is sort of tasked with coming up with the principles to design the program and make sure that the strategy of what's called managed retreat um, isn't reinforcing existing inequities in uh, sort of disaster response and changes in land use. Um, and then there's lastly a third working group called Everyone Has a Role to Play, which is really focused on how we can build capacity among communities, private sector, and community-based organizations to share the responsibility of managing increased heavy rainfall. And so now we're kind of at the tail end of this process. It started in February, and then we're going to have uh, our last like public facing event the end of this month. It hasn't been announced yet, but I'm gonna go ahead and share the link to the calendar for when they do announce the event so that you all can register um, in the chat.
When is that again, Caleb?
Um, I believe the tentative date is the 25th. I don't know.
Of
Um,
June?
yes, I don't know if it has any plans to change, but that's the last date that um I saw. But I would say follow this calendar, and they also Rebuild by Design, excuse me, has a mailing list if you'd like to get notifications about it. And that's like one other opportunity to sort of share your feedback. Um, and we're in the process of developing recommendations for the city to take on. Depending on what the recommendations are, they'll sort of be shared amongst the city departments um, based on who has the sort of responsibility to carry the recommendations through. Um, so even though like the rainproof NYC process will be over, it doesn't just evaporate into nowhere. It's something that the city has to sort of come back and assess what they're willing to pursue, what they can do with the current funding constraints and staffing capacity, um, and how they can sort of continue building on the recommendations with community member feedback in a longer process. And so this is meant to be, more iterative and like a phased approach, but this is just like a new way that they're going about collecting feedback.
But the other thing too is that Rainproof NYC is very much endorsed by Mayor Adams, as I understand it, and many of the several big city agencies are already involved with it.
Right.
Let me know if that's not correct. And it would be great though in the process if there's something that the committees are recommending that needs more endorsement. Please let us know in enough time. Maybe draft a resolution yourselves and ask for support um, for those recommendations. We would like that, particularly from our committee, because we have to stay on top of what's going on, particularly with climate change, how it affects our health. and not be left out. And we've done a pretty good job of that this year with all the resolutions we've had. But I know with rain, all the resolutions that have come out of our committee, but I know with the rainproof, that's going to be very critical as it concerns possible housing, as you mentioned, along the, water's edge and coastline, as well as in some parts of inner city, and what the community needs to do to protect itself or to be cushioned against those rainfalls. So that's
Yeah,
what I'm seeing. And also in terms of Cameron, what he's doing, of course, with New York Heat and all, we could have done a resolution as well, but that didn't happen. But don't hesitate, Cameron, even on your end. I know you presented, I really forgot to ask if there was a resolution, that we could have passed in support of that. Because I know a lot of what we act is doing, really helping our communities in a very positive way. But we need to be in the know.
Absolutely. No, 100%. I appreciate that.
Any
yeah.
questions? Okay. Oh,
Oh,
Caleb, I'm sorry.
I was just going to add one more resource in the chat. Um, if you weren't able, like if this is your first time hearing about Rainproof, there is a recorded virtual session. It is a little long, so I apologize for that. But you can sort of get a feel for our progress uh, as of last month in terms of what kinds of things are currently being considered towards each of the working group deliverables. So you can kind of uh, chunk that up so that you don't have to watch the whole thing all at once. But that's really useful to sort of orient yourselves in the work that has been done so far. I don't think that there's necessarily a need to draft um, what did you say? Why do I
A
want to say
resolution?
yeah, a resolution uh, um, in support of anything in particular at this point, especially because we haven't come out with the completed recommendations at this point. But um, yeah, I think the best way is to just as much as you can like engage with the symposium at the end of this month, and then sort of assess what you want to do next as a community board. And
Right. And
then
that's what I was referring to at the end of it. And I wanted to just alert you now rather than be at the end of the session after, when everything is over with, then have to, you know, suddenly think of something. But what were you going to add, Caleb?
you also had asked about um, tree planting.
Oh, yeah.
So that's kind of part of our extreme heat policy agenda that is going to be published tomorrow. We're going to have a webinar event at lunchtime to sort of go over some of the policy recommendations. It won't include everything, just for the fact that it is very extensive, covering strategies both at the city and state level. So I put the link to register for the event in the chat. Um,
Okay, because we do have, there's been so much discussion over the last 3 weeks about tree planting. We do have a resolution that I don't know if I think I sent it in, I may not have. Anyway, maybe we can get it printed out tonight maybe we can get it printed out tonight. But we do have one in support of that because we know that it's vital for um, assisting bringing down pollen count, or the effect of it on humans, air pollution, um, just shade, providing the shade is key. Number of
mhm,
benefits in terms of tree planting.
right.
Okay. Mhm. And so the webinar, you'll put that information in the chat?
Yeah, it's already in
Did
the
he
chat.
do it already?
I don't think
Yeah, it's there.
it's here.
It looks like it.
I may have to
Yeah.
trying to triple task here. Okay. Any questions
Yes,
for
I have a question.
Heather?
Just we did do a resolution last year from the Parks Committee for 1 million more trees.
Uh-huh.
If you need me to get that to you, Laquita,
We can support that. Yeah, this
right.
coming out of this, that would be
passed
great.
with the general.
Yeah, I remember because
last year. So,
yeah.
but just to, as a review, I can send it out to this committee too as well, and you might be able to pull some things from that. If you, if you're looking to engage as far as adding an additional. My question to you, Caleb, is whether or not the MTA has been engaged in the rain-proof New York City. And the reason that I ask that is because if a property is located within 200 feet of an MTA structure, then you must get the MTA's permission in order to do upgrades to your sewer or water main system. And it's an extremely long process in order to get their approval. And that's something that's considered really an emergency repair. And with the hurricane season coming up and the MTA not providing a way for emergency repairs such as that to be done in a more timely basis. And I'm talking within a matter of days rather than 6 to 9 months or a year in order to get the permission to replace the sewer system. There has to be something must be done about that because it's creating, for me, an extremely environmental hazardous condition to not be able to upgrade a sewer system because the MTA is not providing permission to do so.
Did you hear that? I hope you heard that well.
Yeah, I got most of it. It was a little choppy. But yeah, that's a really good point that I'm also still learning a lot about, the flood mitigation landscape. In my particular working group, we haven't worked with the MTA that, or at least I'm not aware of any like representative from the MTA in the working group, but that doesn't mean that internally they haven't had. I'm thinking maybe potentially working group 3 could have potentially reached out, but that's something that I can ask and raise to the working group leaders to see how they're engaging with like with the MTA and another sort of stakeholder group that is not represented amongst the working group members, but is also of serious concern in terms of flood adaptation are the utilities as well, because I know that they have their own separate resilience plans. So I don't know exactly how they're being incorporated.
All the flooding in the subway systems every time it rains. I'm sure you must be engaged with the DEP.
Yes, DEP is.
And there seems to be a disconnect with DEP contacting the MTA and getting their permission when jobs are located within 200 feet of the subway station. Because me personally, I contacted over 40 subsurface contractors. None of them, or nearly none of them, I think I found one, meet the MTA insurance requirements in order to replace water mains and sewers. And that's absolutely ridiculous for us to live in a city that's based on, public transportation, subway systems, and none have the requisite insurance. And the DEP is not reporting this. And so they're continuing to do work without proper inspections from the MTA and it's causing these infrastructure issues within the subway system because there's no communication between the various agencies, and contractors are doing work basically without the proper permission from the state to do this type of work because the MTA is considered a state agency.
That's a good point.
My
Monique wants to add to,
yes.
or
And I can add, and thank you, Heather, for mentioning that. From personal experience, just recently, a few days ago on 146th Street, where I reside, there was a really major issue with the water mains, which are probably which are probably over 100 years old. So that's the first issue, and you have to be so careful and work so gingerly to deal with those water main lines. And hearing Heather say the lack of communication between DEP and MTA, which I witnessed firsthand, it's just ridiculous and just not acceptable. We should not have to be subjected to that because that wouldn't happen downtown. So, we deserve the same respect as elsewhere in the city, and it just has to be better coordination. So if something can be done with your help to address that, then, we need to make sure that can get done and let us know how we can help. I mean, maybe I sound selfish, but because I've experienced that recently and dealing with flooding, which is what happened, basements got flooded on that street.
that came up at Rain Crew.
And that's
come up.
And that's a major expense that we have to bear.
Yes.
Yeah, and it's terrible. And I mean, we don't have that kind of finances to deal with that kind of stuff. So, working with you to address it is important. Thank you.
Thank you. That's great feedback.
Yes.
Yeah. And Caleb, maybe, I don't know, which committee is, there was some attention given to that quite a bit, but do you recall the committee that, dealt with the infrastructure that way?
That's that's my working group 1.
Okay. So that's something to take back and get some feedback, and if they can present to us, that would be great to get some feedback from us. I'm not sure if it'll be enough time because it's June 25th, so maybe not. But...
Yeah, I mean, this is the opportunity right now, so I'll make sure to take this all back.
Okay.
Yeah.
Some really good points. You have something else?
No, I just want to reiterate, it's been 9 months and I still have not received approval from the MTA to replace my sewer system.
Yeah. So if you have, if in the interim, Caleb, if you find out some information, that's kind of an emergency or emergent need to be addressed, and just reach back to us. And it's not trying to put you on the spot necessarily, but because that's not particularly your area, but there's someone who can quickly get back to Heather. I'm sure she's not alone with that situation.
Yeah, I'll let you know what I find out. I had no idea that was such a point of dysfunction. So
no one is following the rules, no one's reporting it, and this is why we have such a problem with our infrastructure, because people are not reporting as they should be reporting when they're digging near, subway stations. And then you wonder why we're having so much flooding in the subway systems and we're having all these other infrastructure issues because the city and state agencies are not communicating appropriately. And people have no idea. Like I said, I spoke to over 40 subcontractors. They don't even know the process. And they just say, why did you contact the MTA? Well, it's the law. You're supposed to do that. And I never contact them. Just leave it to me. I'll just go right to the DEP. And DEP isn't reporting it, even though they know what the rules are supposed to be. And so all this work is being done without proper insurance and proper permitting and proper inspections.
I saw Caleb taking his notes there.
And I think I'm the only person who actually did the proper reporting, but yet I can't get my sewer replaced or repaired because I'm following the rules.
There's I'm looking in the chat also, and I see where there's several questions. It may be too much to handle right now. Hi, Edwin. But what specific initiatives or program has WEACT implemented to combat noise pollution? But who's handling noise pollution now? It used to be Lewis, who would
Yeah,
come back.
so yeah, Bailey doesn't work at WEACT anymore, but yeah, I think Cameron addressed it well in the chat, because that's
Oh,
kind of outside of both of our areas of work.
okay. And let's see
And we
what
would need
else.
to take Edwin's questions and come back to it later. But as
That
far
would
as
be great.
I know, that's not, I don't think we have any current campaigns focused around noise pollution.
Okay. And more and more we're reading about that, as well as we have a couple of resolutions on that as well. How can community members get involved with WEAC's efforts to reduce, well, again, that's noise, and support a healthier living environment? If there's a membership piece that you email, I know I'm a member, some others among our group may be members too, but if you email something, then we can get that out as well on how our community can be more involved and make it for a healthy living environment in our district. Let us know, and then we'll have to bring you back.
And
Okay.
DEP also is responsible for noise pollution.
Oh, we've had noise. You're absolutely right, Heather. Yeah, because DEP has presented to us. I think Edwin got Umberto Galarza to come. It's been a year now. I spoke to him last week about something else, but we need to have him back. But we have had DEP on 2 occasions with our committee because there was a problem with a parking garage, no, an auto mechanic on 130 something. And I recall that the executive committee wanted some action response. And we had a talk with that particular person. So Umberto was able to come to, he's our representative. So we need to get him back. But yes, we have had DEP involved, but there's always something, and accountability has to be always urged and pushed and urged and pushed and till we finally get some satisfaction. It takes a long time. And then
And if there are any questions on New York Heat, I'm happy to take those. Otherwise, I do have to jump to another meeting, but I think I put my email in the chat. So if folks have other questions, then feel free to send me an email and I'll get back as quickly as I can.
I think we're pretty much done. Since we got a late start, I'm gonna try to catch us up a bit. We're not doing too badly, but we're behind in time a little. Thank you, Caleb and Cameron. Both of you are just doing a terrific job, and we're so grateful that you guys are with WEACT, and WEACT can regularly come to our meeting and report back. Let us know what we can do also. Okay, to both of you.
Thank you so much for your time.
Thank you.
Take care.
Okay, thank
Have
you
a good
guys.
night, everyone. Take care.
Good night. Good night. Okay, let's be moving right along. We have Stephanie Mercado Altman, who is I didn't put the name health resources. Stephanie, I didn't put the name of the organization, so I want you to do that. You contacted the community board district office, and so we're pleased that of course they forwarded your information to us, and we are pleased to have you here talking about the dangers of menthol cigarettes and mentholated products. So if you could take a little time, and then we'll have Q&A.
Yeah, absolutely.
Welcome, Stephanie.
Hi, everyone. Hi. Thank you, Lakita. Appreciate Lakita? Lakita.
Laquita. Oh,
Laquita.
that's fine.
Okay.
Yeah.
All right. Just wanted to make sure. Thank you. Hi.
Mhm.
Yeah, so my name is Stephanie Mercado Altman. I'm the Manhattan Community Engagement Manager here with New York City Smoke Free Public Health Solutions. So we are a program within Public Health Solutions, which is the largest not-for-profit here in the city. And our mission as a program, which we are funded by the New York State Bureau of Tobacco Control, is really to advance tobacco-free norms where people live, work, and play. And the structure of our program is that we have a community engagement arm, which I run. I help residential buildings and businesses go smoke-free through voluntary policy adoption. So these are essentially policies of smoke-free, distinctions where spaces are considered tobacco-free. And then we have a youth engagement arm, which is called our reality check program, where we work with youth 13 to 18 to become tobacco-free advocates. So they run seminars in their schools. They host informational sessions, assemblies, and things like that. So just that's a little bit of background of who we are. But at the current time,
In the schools, what elementary, high school, both?
13 to 18, so effectively middle school to high school is who we would work with, yeah. I do have a slide deck. Can I present that?
Sure. Let
I
me
started
make
talking
you.
then I had a whole is my talking point German, which I want everyone to access.
1 second.
Yeah, take your time. Thank you.
Okay, I just made you a co-host.
Thank you. Appreciate that a lot. All right, you can see my screen. Yeah. Awesome. So I talked through those points already. But yeah, just a little bit about menthol. I'm not sure if anyone is familiar with menthol as an ingredient in tobacco products per se, but it is essentially, if you've heard of cool cigarettes or have any, tasted like minty flavors of any sort of vape product or tobacco product. It's extracted from peppermint, and is also synthetically made. And the idea of menthol is really to cool the throat and kind of help the harshness of the tobacco smoke or even vape smoke to go down. So menthol is found notably in tobacco, cigarettes, and also in vaping cartridges as well. As for menthol cigarettes, this does represent 25% of all cigarettes that are sold in the US. So it's been a big issue, especially here in the city. I'm not sure if you know of the bill that is out there with the city council, but as New York City Smoke Free, we're just here to bring awareness about the issue and hopefully build partners within our coalition and do outreach in the community as well. But more to that at the end. But basically, menthol tobacco products have become a big public health concern. And this in particular with menthol smokers or people who smoke menthol products in any sort of way are more nicotine dependent and less likely to quit than smokers who use traditional cigarettes, so those without menthol in them. Menthol does contain about 30 to 70% more toxins than non-menthol cigarettes, including tartar nicotine, and namely an average cigarette does contain about 7,000 different kinds of chemicals and additives and things like that. So that's alarming as it's I can't speak today, I'm sorry, as it's a statistic. But yeah, it's really important to bring awareness of the issue. And namely, too, menthol cigarette smokers have a lower rate of quitting than traditional smokers. So we say with menthol products that it makes it easier for people to start and harder to quit because of the addictive nature that it does impart on consumers. And like I said before, menthol is also added to a variety of different vape products, and vaping has especially become not useful, but a popular mode of, I guess, cigarette consumption sort of within our youth community as well. So that's another epidemic within the larger tobacco epidemic too.
Wow.
Yeah, so, and then looking at vulnerable populations, especially, it's especially important to bring issues like this to light because namely African-American communities, and here we are in Pride Month with LGBTQIA plus or A2S plus communities are affected in youth. With African Americans, though, in that way, 85% of African American smokers in New York City use menthol cigarettes compared to 22% of white smokers. And 70% of these smokers who are of African American descent begin in high school or middle school. So in that way marries the kind of the racial and the age concern together. And namely 460,000 and more African Americans estimate will have started smoking because of menthol cigarettes. So it's a high number. And as we look into Pride Month, supporting our communities who are of different gender and sexual orientations, 36% of menthol cigarette smokers are part of the LGBTQIA2S+ community, and also 2.5 times more likely to smoke a cigarette than heterosexual individuals. So that's all from the Truth Initiative. And then, to add on to that, and these can be all identities that one person encompasses too. So I think it's really important to draw the intersections of that. But more than half of our youth smokers who are currently in public school in general, do use either menthol cigarettes or use mentholated vape products too. And with the youth, there is a greater urgency, and we have worked with our youth to bring about awareness about menthol and vaping too, as a concern. Yeah. So I think with all that said, I just wanted to present like the highlights for just how ways we can work together, hopefully. So we would love to see if there's a way that we could collaborate, or I could collaborate with the community board and the health committee too, to see if, specifically, I'm happy to draft up a social media post for either your Instagram or Facebook if you use either of those communication modalities. We also have a movie called Black Lives, Black Lungs, which is it's a historical deep dive into menthol cigarettes and the pervasive marketing and dangerous tobacco marketing that has taken place in the African American community. And we've hosted community sessions on that, community discussions. So, if there's a way to collaborate on that, we would love to do that. Probably an hour tops of like an event, or we could table, whatever capacity, CB9 can, facilitate. We can discuss that, I think, with the Q&A at the end. But also, like, in light of contributing to your newsletter, I'm also happy to write a blurb or any sort of kind of informational paragraph on menthol and why it's important, and a huge kind of overlooked issue that we don't pay attention enough to. And lastly, if there are any introductions that the health committee or CB9 can facilitate in the way of connecting with community-based organizations in your neighborhood that are health related, LGBTQIA+ related, we'd love to see and meet those folks and see how we can collaborate. And namely to their youth organizations that work with youth ages 13 to 18. We'd love to see how we can make and build bridges there. So yeah, I wanted to make it short and sweet. So if any questions you guys have, I am more than happy to.
Stephanie, I have a couple of things. We have our Youth Education and Libraries Committee that we are currently partnering with a youth workshop that, and I see Wendy, I'm not sure she's on with us. She's on, but I'm not sure if she's right there at the phone. She may have stepped away. And then we have Dr. Christine Marizzi, who's going to talk to us at the bio bus. But for the community board, we have the Youth Education Libraries Committee, and we have an LGBTQ task force as well. So I can put you in touch with those committees. And right now we are in a partnership with the YEL to present a youth workshop at one of the community-based organizations, Graham Wyndham. Right now it looks like June 18th. But I don't know if, there'll be time in particular, depending on how long it takes, if it could be something that you can join in on or make an appointment to talk to their school. I think it'd be great if you spent time at Graham when they have you could come in, and you could probably work very nicely with Ms. Viviana Thomas, who's terrific. So I can put you in touch with her. And then we have the basketball coach. I'm hoping the teams are not smoking, but we never know. They're playing sports. You never know.
Yeah.
So we can put you in touch with him too. His program starts, I think it commences June 15.
Okay.
So if you could touch base, so just as a reminder, because right now I feel like it's hard to type and then,
That's okay. Yeah.
you
I can
know,
follow up.
say, give the information at the same time.
Okay.
Okay, so that's what I have right now. Monique, did you have your hand up for something?
I didn't.
Okay, is there anyone else, with a question? If not, there's one other thing, Stephanie. At Columbia University Irving Medical School, there was an extensive study done on the impact of menthol tobacco as well. And it seems to correlate very closely with your presentation, but it doesn't hurt to talk to their researcher. And this was over a year ago, so I don't remember the doctor's name, but it's still a fresh study. And I think it was within the last year and a half. One of their research did the presentation.
Oh,
And
wow.
it was and I can give you the contact of who you contact, but the actual physician who did the research, I don't have her name, but it would be great for you to touch base.
Yeah, that would be.
You're not already in touch with them.
Yeah, I'm not, which should be awesome to connect with them. Yeah.
Okay.
Definitely look it up. Thanks.
Okay.
Actually,
Monique?
I mean, I was listening to you, Stephanie, and thank you for your presentation. And if I missed something, forgive me, but by your comments, it sounds like, is there like a resurgence in terms of the use of menthol in these products, especially since we have vaping?
Yeah.
And I say that, yes?
Oh, no, finish your thought. I'm sorry. I was agreeing with your line of thought, but go ahead.
Only because, I mean, not too long ago, I remembered there being a concerted effort in terms of signage in our community, the presence of signage promoting cigarettes and things in our community, and the efforts to remove that so that we weren't being targeted. And I am trying to recall if, in the part of that messaging, if there was a focus on menthol cigarette products. So that's why I was just asking, has there been a resurgence of menthol in the most recent time period?
Yeah. I would say there has been. I think, we traditionally think of like the Kohl cigarettes or kind of the Newports that have been out on the market since before I was born. I'll just put it that way. I'm 33.
Correct.
I'm deciding my age. But with the whole popularity now of using vape products and the various amounts of vape devices that are out there and the various amounts of flavors that are out there too, in a way the resurgence of menthol has definitely happened again. And vaping is not only easier to start because of the smoothness, but menthol has that additive factor. It's making it even smoother to breathe it in. So yeah, there's a big concern about it. Absolutely. Yeah. Does that answer your question?
Is it more popular than cannabis among teens?
That's a great question.
Yeah.
I don't know this. I can find out and follow up with you about that.
Yes.
Yeah, because
I see a lot
cannabis
of
is a
teens
huge
with the
concern.
cannabis also.
Yeah, no, that's it. That is a good question. You have those two things happening probably on parallel tracks.
Yeah.
So find out and then definitely come back to us.
I will follow up with the committee. Absolutely.
Any other question related for Stephanie? And Dr. Marizzi, are you there, Christine? She's somewhere there. Dr. Marizzi has the bio bus. Oh, she may have had to take a phone call. That's right, because she's in her office. And there are 2 programs for young people that she has to announce. And ooh, okay, so maybe we'll have to come back to her. So we also know that June 19, there's a sickle cell awareness day. And I asked Dr. Manguia if she would give a very, very brief presentation update just on the sickle cell. We do have a program that we'll announce and hopefully get flyers out on. But for right now, if you could just talk about sickle cell, Clotilde, that would be great. Dr. Manguia. Is she? Oh, she has her hand up.
She does.
Yeah, I'm here. Thank you
Okay.
for giving me the floor. I don't see so much to add since this topic was largely presented by myself in November when I was in a meeting in London. So briefly, I think everybody in this setting of the CB9 to 9 knows about it. So I will be focusing more about why interest now of the sickle cell in terms of research and increasing research efforts. And I will be focusing on access to treatment, not in West Harlem, but in Africa, where I'm currently now, which will be pretty new for you because you know already that most of the people in West Harlem have universal health coverage and pretty much receive good care. So I will say that for the sickle cell, which is, you know, a genetic disease, which affect mostly African and Hispanic, which is linked to the malaria belt, account for more than 100 million people suffering worldly. But this disease was discovered in 1910, and since then, very few drug was in the market. And we can even say that before 2017, there were very, very few treatments had reached the market within the last 2 decades. It was neglected because of disparity, etc. We all know about that. No research. But in November 2019, a Swiss company marketed a drug called Adakveo, which was approved by the FDA and became one of the first treatments to specifically target the excruciating pain affecting the sickle cell warriors, as they are called. So since then, for the past 5 years, more treatment has been approved in the US. This interest by the pharmaceutical company also was acknowledged because of the advancement in the DNA sequencing and technology. We all heard about the biological Caesar, which led to the CRISPR, which led to the gene therapy. And we also know that since December the 8th, the US approved gene therapy treatment, but for the battle for the United States and the patient warrior is about access and affordability. So, but the sickle cell approximately affect about 70% of patients who live in Africa. This genetic mutation, which occur as a, I would say, species survival, because as you know, sickle cell patient doesn't suffer from malaria. So the blood red cell take a different shape in order to avoid and to escape the malaria mosquito. But that shape is inconceivable within the circulatory, meaning that because of the tissue, organ are deprived of oxygen, that cause the organ to degenerate, to be damaged, that cause extremely excruciating pain. The people who are affected by the sickle cell are prone to infection, particularly they are affected by pulmonary infection. So Africa is still challenged because they don't have access to those new technology, even though the essential treatment until now in 2024 is the hydroxyurea. It's still not affordable for most of the 70% of people living in Africa. So this is more or less what I wanted to talk to you about, which we know that June the 19th will be around that time. We having an event online or hybrid. I guess Miss Laquita will talk to you at length about the platform of the event. You are all welcome, but all the months of June will be a month of awareness. So we are at the point where people need to be aware, because just in New York itself, we don't even know how much sickle cell patients are. But once we started talking about sickle cell, we found out almost 1 in every 3 family of Black African in around West Harlem are affected, had people, cousin, family member who died from the disease. And this is a concern. So as for the West Harlem, the battle will be to access quality of care, gene therapy, but the tag price is about $2 million. As for the African, it's gonna be the fight of awareness, stigmatization within the family, and the hydroxyurea. This disease, and I'm gonna be short and finish, would have been ignored it has been ignored, but we really need to pay a very close attention to this, because this affects, in Africa, it affects mostly children. And those children they die before they reach 5 years, they are mostly dead. So there's a stigma, there's an emotional or financial toll within the family. There's also a disconnect emotionally. When you are a family, no longer than last week, I was in a village, and one family had already buried 5 children. That child died within a few days with chronic anemia. I can tell you that this little girl was probably neglected because the family knew that she will die pretty soon, and they didn't invest on her. So you can imagine in which hard situation, the family, how they live. Some other things I can say. The hydroxyurea in Africa a treatment cost about $30 a month, when we know that half of the people doesn't live with more than $1 a day. So I will say that today somebody is online putting things on the chat, which is Dr. I don't know, let me tell you who that is. And maybe he has something to say and to add on, and I will let him the floor. So I can look at that. But anyway, now we have the gene therapy available in the US. I don't want it if it's a repetition of what I've said already. So I will let him, Mr. Laquita, can you give the floor so we are to corroborate about that? Mr. Edwin Torres, can you talk and maybe add more? Because you do clinical, and which I don't do. And which I don't do, and I don't know if you have more news to say. Let me read.
Oh,
This is
okay.
it.
I'm
That's what
looking at the, okay, I'll ask to unmute.
So
Oh,
hi,
there he is.
Frida.
Hi, Edwin. I didn't,
okay. I'm
thank
gonna be leaving because
Hi.
it's very
before Clotilde
late for me.
Before Clotilde leaves and before Edwin talks, I just wanted to add that Clotilde, who's working, I think you're doing consulting work, I saw on your papers, in reference to sickle cell, and you were instrumental in uncovering the legislation with New York City, where it passed in the city council, although Mayor Adams, I understand, did not sign it. So that's interesting, unless he has since signed it. Uh, but maybe he didn't sign it because of budget cuts, I don't know. But New York State also, it passed the legislature, New York State, led by a couple of the assembly persons whose names I don't have the bills right in front of me. In addition to the announcement that you learned of Dr. Manguia in London, and 2 days later it was in the New York Times, everybody was talking about it. Since then, there's been the legislation, and that's going to help bring far more attention. And so that's commendable in terms of what the legislators are doing, at least trying to provide some financial resources, because it's going to cost. It's going to be quite a cost, even with the new therapy. And then the other thing that I don't know if you had mentioned it, Dr. Manguia, or Gwen, um, who is a friend, and we were in conversation, and Gwen Black, and that the reason it may be a little less, the numbers may have decreased some in the States, is because now people are doing, well, if they're getting married, they're looking at their traits or what may be susceptible to the disease.
No,
So that,
what really
it might
happened is
make
the
an
quality of
infrastructure.
care in the United States. This is the quality of care, which is different in other settings. That's what the neonatal screening, prophylactic antibiotics has been, is a standard in the United States. And of course, the universal hydroxyurea. That has made the difference. And also because in 1971, Nixon signed a bill that provided a budget for about 20 years. What they wanted to prove is that if we improve the quality of care for people affected by the disease, and you can show me the data that saved life, then I will put more budget. It did well. The data showed that there was a survival, whereas you were dying for this disease by the age of 40. Now I have a friend, she's 72 years old, 4 children, and still alive. She lived well. She's in pain, but she lived well. Whereas in Africa, no neonatal screening, no prophylactic antibiotics, no hydroxyurea because of the accessibility and the cost. And children die before the age of 5. That children have stroke by the age of 3, 6, 9 months of age. So that's what I have to say. Nothing else, but I do believe that we will know probably more about the sickle cell, because we have a range of experts from New York who will be talking at length, and we will have the perspective of the warriors. They will tell us about the struggle they faced in their daily life. And they have other things as well, reproductive health, social justice around this. We can add also the climate change impact on that, about hydration. So I do believe it's going to be very interesting.
Edwin, Dr. Torres? Hope he didn't go away.
Hi, thank you, Laquita. And you know, so the sickle cell disease is something that folks in the equator, they have a higher prevalence of African, and you can see the same thing happening in the Caribbean, Jamaican population, Haitian population. It is a terrible disease, and the inequities that exist not only from community, country, and continent is something that shouldn't happen globally. We believe that everyone should have access to. Now, there are companies who have CRISPR therapeutic. These are, genetically, they go and they work at a gene level. These companies, they have approved gene editing therapy for sickle cell. They cost millions of dollars. Now, the money is as to, whether people have access to this. I can tell you that we have drugs for cholesterol that when they first came out, not everybody had access to them. Now they're pretty much accessible throughout the world. When new technologies come out, just like the iPhone, when they come out in 2016, not everybody had access to the first iPhone. But now it is more accessible to people. So that's no consolation for somebody who is dealing with the disease at this moment. But that is something that there are other stakeholders that have to answer these questions. When it comes to the Community Board 9, I'm unclear as to the charter that we're taking on with this, this global perspective. I can appreciate from the Community Board looking at this of what's happening in our community in the New York City. But beyond that, there are other platforms that have, direct contact into these matters from a global health perspective. So I need a little bit of clarification when it comes to that, because I'm sort of not understanding where, do we look at Community Board 9 and CB9 in New York City, and where do we go into more of an international advocacy platform? Because I think that we have to know our capacity in utilizing our resources, because everyone here has the heart in the right place and they want to make sure they're doing great. But we also need to make sure that we are shooting our shots in efforts that are futile, and that we don't grow frustrated because we are in the wrong channel addressing issues that are more from a global health perspective.
I would like to get this conversation, which doesn't have to take place here. I don't know if you know that there's undocumented immigrants, mostly from West Africa, where the prevalence incidence is extremely high. They come with this disease, meaning that when they get into the emergency room, they use those resources.
I'm very well aware of it. I work in the ER and I've seen them.
Yeah, so they are here. The United States, particularly New York, welcome people who are affected by that disease, and they have no choice. One thing. Second, most of the doctors, Columbia University, Sinai, Montefiore, when I'm in Bethesda meeting on sickle cell, they always have a global perspective. So we at CB9, we don't treat, we don't conduct our policy, we bring awareness, and it's our responsibility to consider everybody. No one is left behind. So we have French-speaking countries, inhabitant, we have Spanish, Caribbean. So we're not gonna decide that we're gonna treat only the original people living in West Harlem and leave maybe 2/3 of the people who are from Africa, the Caribbean. No, we're not going to international level. We bring awareness. Why do you think in September we have the General Assembly where all those heads of state come here if New York doesn't want to be a global platform? So I don't think this is a place to discuss about that. This is a place to discuss about the pain and the excruciating stigma that the people who are affected by this disease who live in West Harlem are affected. The rest of that discussion doesn't have to take place in this platform.
I think I agree. I think we're on the same page here, Clotilde. I think that you know, it was very clear that when it comes to CB9, understanding the prevalence of the epidemiological, data with the people who live here, it is very important. I don't think I disagree with you there. Whether or not you are documented, that doesn't matter. If you live here, you are a resident of this community, and we embrace you. I think that my point is to where we go out of CB9 in New York City. When we speak of the assembly, we do know that New York City, it is a global city. However, there's so many different jurisdictions that take care of, issues that are happening at a global stage. It is nothing wrong with looking at, for example, diabetes, right? You look at the IDF, you see the global numbers, you see the New York State, the US number, the North American numbers, and then you put it to to more of a closer, proximity, where you look at New York State, then you look at New York City, and then you can put at a granular level of CB9. Nothing wrong with doing that. But like I said, my question was in regards to the effort that folks are putting into this. And I didn't say to diminish the folks who live here. They have to be treated. And some of them are being treated, and to create awareness, it is fantastic, not only of sickle cell, but of many other diseases that folks come with, right? So I think that my question wasn't to say not to pay attention to them, but indeed to include them. Now, when we're speaking of another country and, how much a medication costs there and what can we do, I think the power of CB9 when it comes to awareness is quite limited when it comes to that.
Oh, of course. And that's why I guess everybody has a responsibility. We African, we know, but we also know that New York is a good platform for us to advocate about, to fundraise about, and you could have been the one to present that case tonight because it was more towards the CB9. You selected me, which I had already presented that case in November, which is not new. But I'm here in the Congo. Do you want I will keep my mouth and not talking about what I'm seeing every single day here? This is another way to present it. So I'm here in Kinshasa. I'm not at the CB9 where you want me to say that Eugeryxuria. I don't even care about Eugeryxuria. We care. The battle for New York is the gene therapy. But for me, my reality is different. And I bring it into this.
That is very commendable, Clotilde. But
so anyway, at this point, I want to thank you, Clotilde, because we are going to be doing.
Thank you so much.
We are going Edward as well, because he has a lot of information. I think in a way you both are on the same page, really. It's being worded very differently. And
one thing I want to tell you is this: I do not think that the June 19th should be a big event. Not at all. I do read between the lines. I'm here in Africa right now. I'm telling you, every single day I'm talking on a platform. I designed my trip with very few expenses. So I do understand you, Mr. Dr. Edwin, that we're probably putting a lot of too much, but it depends where you stand. I appreciate you give me the floor for this tonight. I didn't want it to be heated that way, but I'm sorry to let you know that there's some few things that I would like you to know that I will not tolerate. You
Let me say
speaking
that,
on language
Dr. Manguia,
and
let me
putting that
just
on the
say,
platform.
the other
Okay.
can go off, that could be offline. But the idea,
Oh,
the reason I
you
asked is
you look
because
for it.
June
You look for
19,
it, and I'm gonna tell you about that. I'm a professional, and I don't leave anybody out.
right. So June, the reason I wanted to have you talk about it is because it's kind of the first time we had not the first time, but because June, that day is Sickle Cell Awareness Day. Last month, for example, May was Mental Health Month. We had speakers in on that. So every month, many of you may not necessarily notice it, but we generally have some presentation related to something uh, that's been designated in the month. Sometimes we can't do it. Sometimes because we have so many topics, but this is an exciting one. So, and we're dealing with it here in New York, and then of course by virtue of us being in New York, it's kind of like saying across the country because of the exciting gene therapy. So we have several media possibilities. It's too much to really put an in-person event together, but our message will go farther and farther because of the media interest. And I'll take this opportunity just now to say that interviews have already started. WPAT, through the Audrey Adams report, has a radio program and television program. And on both of those platforms, doctors that we have gathered who are one is a researcher in that area, the other is a clinician practicing in sickle cell disease. And then we have actually a great friend of our chairperson, Victor Edwards. His good friend has agreed, I want to call her Doctor too, but anyway, Miss Montez Davison has been terrific, and she is a great survivor. And so that's going to be on radio and in formatted for television as well. It's upcoming, so we'll be able to release the dates after probably after Thursday or Friday. We also have Soul Lounge, part of WHCR Radio at City College, with Curtis Archer and Bob. Oh, what's Bob's last name? All of a sudden, he was he's very well known. Oh, Ponte, Bob Ponte at WHCR Radio. They will also after June 19th. So we'll see. I believe I know Dr. Elijah D. Williams from Columbia will also participate in that because he's going to talk about the importance of African Americans, people of color, Hispanics, all participating, with responsible researchers to just get involved and get the data we need to really help our community learn how to be better treated because we've provided them, whether blood, skin, whatever is needed to conduct research and improve information that we can import to our community. And then finally, there is, we're going to do the committee, an hour-long presentation. And actually, because things changed a bit, I wanted to ask if we'll try to do it on June 12th. But everybody on the committee has a role to play in this audio-visual presentation. And Dr. Williams was saying it could go to our hospital, which means all their hospital locations, clinic locations in the city, and schools and all to learn about this I don't want to call it an epidemic, but really this, an unfortunate circumstance, but how these new developments are happening, and just to make the community and the broader community more aware. And actually, some of the radio and TV formats will go nationally, including ours. So there's a lot going on with that. So this was just an update. And Dr. Torres, thank you so much. I know you stay on top of things, and I appreciate your input also, that you really delve into the public health. And we have so much going on in our community, it's true. And basically, whatever we can do here and the research and data that comes out of our community can be used nationwide, actually. But our main thing is, you're right, we do have to make sure people in our community are aware. And it's really hard to reach out to them. So the media in this instance will be our platform. And having said that, we're not too far behind. We're getting a lot covered. And thank you both again, Dr. Torres, Dr. Manguria.
I have a quick question.
Yes.
My name is Dan Clark. I'm new to Community Board 9. I don't know if it's a question for you or for I'm interested in this sickle cell topic. I'm a teacher. I have a student who has sickle cell. It's never in class.
Yeah, the pain. They can never know. Sometimes they can't make it in. Yeah.
Yeah. And I had a girlfriend who also had a sickle cell, and I remember she was, I don't think the medicine that they talked about was available at this time, but she was taking like pain medication. It was like Tylenol.
Well, it's interesting. The clinician that we got, Dr. Cheryl Mensah, will be able to talk. She actually treats patients in a clinic. She's a specialist and involved with various aspects of treating and studying sickle cell. She's an instructor also. So that's why the media work that we're doing is going to be really important. And actually what Dr. Torres is talking about, just having those groups right here in our community so that we can, inform people. So we'll keep you posted on that. And then also Dr. Curtis connected with Mount Sinai. That's one of the ones that Dr. Manguria mentioned. She's a researcher. And she is also researching cannabis and how medical cannabis can help with pain. She's a sickle cell specialist. So I'm also of the mind that she may be looking at it as a way of easing the pain of those suffering with sickle cell disease. So that's going to be interesting to uncover, to find out, not to uncover, but for us to find out from her. So there's a lot going on locally. What happens here, generally that information gets imparted to other areas of the world. The main thing, of course, is the cost. And then, of course, the gene therapy, I believe she'll be able to talk about, though she was not directly involved with the gene therapy. But there was a big story from the New York Times a month or a little bit better than a month. There is a young 15-year-old Black male who is the first to participate in the gene therapy. And so it's a year-long study, and hopefully we will be able to, you'll be getting information from him as well through the research that is underway. And it's underway right now, but he just started. Maybe he's been on gene therapy for a couple of months. I'm not sure how long. But it only helps a sliver of people, as I understand it. So there's need for more research, and that's where the other researchers come in. And so I believe, and I'm going to ask Dr. Curtis, I believe her study of medical cannabis is going to be something to help with the pain. Some years back, bone marrow transplant helped so many, and there are some who are, as I understand it, sickle cell free, but they're like teenagers now. So, but the ones that are much older, it may be difficult, but we'll learn more. I'm learning as we go. So just stay posted. Our media outreach will be announced. And so you'll hear about it and just listen. And like I said, it's going to be through our area hospitals and across the city, probably clinicians. So we found some people who really know. Okay. Anything else so we can move forward? Thank uh, everyone in reference. Thanks, Dr. Mongolia, for your information and research on with sickle cell and what's going on with that. Dr. Christine Marizzi, she's there. She's here. She's on the phone. I know that you have 2 programs. So just briefly on the BioBus, introduce yourself to those on the phone. And since the beginning, not from the very beginning, but we do have a committee quorum. We've had one for quite a while, maybe 2 minutes after we actually started, just so everyone knows. Okay, Dr. Marizzi.
Thank you again for the opportunity to speak also last minute, and I'm gonna make this quick. I'm here, I represent BioBus. We are a science education organization located in Harlem. We do share space with Columbia University, but we are an independent nonprofit. And we have a lot of high school students and smart youth actually doing internships with us. And I want to invite you all to our upcoming Student Research Symposium. I have been putting information in the chat previously. Apologies about this. I had just very spotty Wi-Fi. But it's that we're going to have 2 symposia. One of them is going to be on Monday, the 10th from 4 to 7. Inside of Columbia Zuckerman Institute, where our Harlem Biobase is located. We will present research about air quality, about soil quality, about stressors, all that actually what WEACT also mentioned. And this is a free event. Please feel free to join and cheer up the local youth doing research that actually is also pertinent to the community. And the second one is actually our New York City Virus Hunters Junior Scientist Research Symposium. This is not going to be on the west side. It's actually going to be happening on the Upper East Side, New York Academy of Medicine. We are going to be presenting research about diseases circulating in viruses in the urban area. And we're also going to present research done by the students if actually the milk is, like at this moment, safe to consume. For people that's just wondering about this, yes, there's actually avian influenza in the United States right now, and we actually keep close tabs on it. So I'm really inviting you to come and meet the students, meet the community, and we would all love to have you here. I'm putting more information in the chat, how you can find us, how you can sign up, and also for the MDs and doctors in the audience, I actually put some publications in there. Some of them actually have the students in the author byline. Thank you so much, and that's all I have. I know it's usually a long and packed agenda, and thank you so much for your time.
Thank you very much. And if you have, I know you sent the links. I will just give me a reminder, and I think you may have. I will put that. I'll send those out. I'll just have a mailing sent out to.
I send you flyers. I just want to make this very short and sweet. Yes, thank you so much.
Oh, okay. Thank you, Dr. Ritzy. Now we also, I guess there are no questions. I'm not sure if she's still there. Any questions about BioBus? Or what was the new events? Okay. Just stay posted to the information I'll send you related to the additions to her program. And now we have, I wanted an update on cannabis from the co-chair of the Cannabis Task Force, Monique Hardin Cordero, who's not only a member of our committee, but she, as I just mentioned, is co-chair. And then she's second vice chair of the community board, so she wears several hats. So let's hear from her related to an update on cannabis and what's been going on with that.
Thank you, Chair, for allowing me to speak. I'll be brief. I will start by saying that the Cannabis Task Force meets every 4th Thursday of the month, and next month will be our last meeting until we convene again in September. So we met in May, And we were fortunate enough to have Lieutenant Savia join us to provide an update regarding enforcement efforts as it pertains to the number of illegal establishments in our CB. And I'm going to make sure I refer to my notes so that I can be clear and cogent in my comments. But I will start off by sharing and literally what the lieutenant said. The lieutenant reported that, and we've all heard in the news that there's been a concerted effort in terms of locking down these illegal establishments in our community, because we know there are detrimental effects when these establishments are in place and they're distributing product that's not been properly monitored or vetted. And so we know that the officers from our local precinct are partnering with the sheriff's department to remove illegal product and have been padlocking establishments throughout the CB. So we know that's been happening. The lieutenant had shared that there were 21 closures of illegal establishments in Manhattan North, and the precincts specific to the areas covered by CB9, up to 21, one closure of an illegal establishment happened on May 15th, and I was in precinct 26. And in terms of precinct, the 30th precinct, I should say, I believe there were no closures reported at that time when we met. But of course, efforts are still happening. And the last comment from the lieutenant was that his team wanted, of course, assistance from residents in our community. They weren't familiar with those establishments that were in fact legal. And that's probably because there haven't been really too many in our CB, and asked for our help so that they could be aware of those establishments that are legal, so that therefore they can target their efforts probably more towards those illegal establishments and make sure they get shut down. Any legal establishment in the city will have a special sticker in the window, which has, I believe, a QR code that you can scan, and that tells you that it's legal and can operate in a appropriate way. And I can say that, as far as I can tell, and actually one of our committee members kind of flew in, I don't think that we have any legal ones yet, and one may have been approved and pending to be established. So I think RCB has been fairly lucky, if you can use that word, that we haven't been bombarded with the number as many of the illegal establishments or legal. Well, actually, let me rephrase that. We haven't been bombarded, which is, I guess, is a good thing. But things are evolving, and we're trying to stay on top of it because we want to preserve the quality of life in our community, because we deserve that. So the goal is to have the lieutenant to keep coming and reporting out on those efforts, and we'll keep sharing those efforts with people so that people are aware. So that is the first thing. Second thing is that we also have been working very closely with City College and the Harlem Health Initiative. They're doing a lot of tremendous work in RCB in terms of trying to track data, specifically the cannabis equity study that they've been working on for some time. I want to say since the beginning of the year, when they've been mapping processes to identify illegal cannabis outlets across Harlem. And, this is an ongoing effort, and the highest unlicensed dispensary density, and I'm reading the notes, was identified in East Harlem, believe it or not, compared to West Harlem. And it says the demographic differences were detected by community board areas. you know, and that's our job to be on top of what's happening. With East Harlem having the highest proportion of Hispanic Latino residents, adults without a high school degree and poverty rates of about 31%. The other thing in terms of the study is, or the study suggests that unlicensed cannabis outlets have congregated in low income, high crime areas in Harlem. And I know they're still doing work around this, but one thing to note, and I'm going to pull up my glasses to make sure I read this correctly. The concentration of unlicensed cannabis outlets raises questions about how concentrations of these outlets might impact crime, home values, children's exposure to secondhand smoke, cannabis advertising, and the age of first use in the future. So I know these are some of the things that they're looking at, and we will continue bringing them back as they continue to dig deeper into the data and to share it with us so that we know how to effectively engage with our residents in the community, not only to get information out, but to stay on top of what's happening so that we can have better control. Once again, we want to support those individuals who want to establish dispensaries legally. Period. And educate those in our community around that and making sure that people have the knowledge and information so they can make smart choices. And for those establishments that aren't legal, then, you know, the consequences are very clear. They're going to get shut down, as they should, because we don't want to inflict harm on our community, as our community has already suffered so much. And I want to add that we're not looking to criminalize people, because I know that's a part of the whole effort around, you know, trying to open up these legal establishments. But, you know, at the same time, we want to protect the people in our community. So we're trying to work and make sure there's a proper balance in doing that. And I'm trying to see what else I can add. Laquita mentioned this effort in terms of using cannabis in a medicinal way to treat many of the ills that affect those in our community. And what I'm hoping to do with some of our task force members is to explore that more and to see if we can get a presentation around that, because one of the things that we've talked about how difficult it is to get information regarding medical cannabis. How do you know, even find out where those locations are? And I'm also, so I want to work with our task force to have a presentation that talks about how we identify those places and how people can access that information. And my last comment is the task force is working on rules and regulations that will help us so that as illegal establishments become more, I guess, apparent, we want to have something in place that will help us in a thoughtful and effective way look at and determine if an establishment should be brought into our community versus not. And, you know, ultimately, the Office of Cannabis Management decides who can open up an establishment, and that's done by lottery. But certainly as a community board, we can weigh in and comment if we have concerns and share those concerns with the Office of Cannabis Management, which we have been doing and will continue to be doing. So at our next executive board meeting, with feedback we've gotten from our task force members and some of our committee members, as one of them walks by, we are going to be sharing our rules and regulations with the rest of the community board members, making sure that we're solid on that, and then beginning to use those rules and regulations to help guide us in our decision in terms of determining who can come into our community. So those are some of the updates, Chair. And if there are any questions, I'll take those questions. And if they're not, I will say thank you for allowing me to speak.
I just have, let's see, oh, it's Hakil here? Who? Hakil's here. I was just gonna see if we could get a copy of two proposed resolutions, but I thought I saw him go back there. Okay, so I emailed them to him. I forgot to send them out earlier. One, with every positive thing that happens, there's always something that we have to be on guard against, it seems. I certainly appreciate and approved cannabis being legalized because I felt it was an injustice and very unfair for largely what ended up being largely young men, well, some could be older too, of color, being arrested and given the harshest of sentences just for the possession of marijuana, of which cannabis is a part. So I appreciate that. When it came into full, I guess, recognition and force and convenience here in the city, the thing that began to bother me was the smell, the odor, and walking through it just, even in my building and just other people's buildings and mostly young people and just those not really having any respect and maybe I doubt if they think of it as not having respect. They're just smoking, but not aware of how it could be not only distracting, but just uncomfortable in terms of smelling it, ingesting it for other people. So I'm just wondering if in the process of the education component, if something could be introduced from our board about when people purchase it, just maybe finding some way of saying when you inhale this, when you take it in, be mindful of where you are, that kind of thing, and just without being super restrictive, but at the same time, they have their rights since it is law, but at the same time, practicing some of the practicing some etiquette or some constraint in terms of where and how, or if there's some other device that could be made where I don't like people have those pipes and where pipes smell too, but whatever. Yeah. A friend of mine does a lot of vaping, and so I'm like, you don't smell it, but it's there. I don't know if something could be invented or what in the interim what could be done, but on the education part, I think that would be good, and it would perhaps bring down some of the criticism because now there are people, who are just really complaining a lot about that part. Well, every problem is not going to be resolved overnight, but if that's something that could be taken up, the etiquette of cannabis.
I mean, I know certainly in terms of the establishment of legal places.
Oh, and Edward has his hand up. Okay.
Right. We discussed being conscious about odors and its impact on the establishment and how that might permeate and affect local places. And I guess that would be focusing on a consumption lounge, because right now, our focus had been on dispensaries where the product is purchased and then you're walking away and not consuming it there. Now I see Heather shaking her head. Legally, that is what is supposed to happen, which is why.
But the education material could be given there, or they can have someone say, remember, when you do partake or when you do use this.
Right.
Because people are just so open now. They're driving or they're just sitting in the car and that odor.
I mean, once again, really, I hear you. And I'm all about us as a task force and working as a community board to educate people, because I feel with education, knowledge is power, and it helps you to make informed decisions. So certainly, I'm writing it down, and I don't see that as being anything harmful. Obviously, it's an issue that that is affecting everybody in the city, not just our community. People are walking around smoking
Oh, yeah.
freely everywhere,
Wrong.
and it's strong.
And then the other thing that seems to happen after that is the spitting.
Oh,
Now, I don't know what that's about, but in a in a building, I mean, they're right in front of you
yeah.
on the lobby floor or just walking along the street. Well, that's the problem anyway.
Right.
But it's something with the cannabis also, which seems to me to say something's not right, that maybe their body shouldn't be taking it in. But
Well-
that one of the doctors talked about that
Right.
part. So anyway, but still, that's the other thing. And I guess we can mention spitting because even on the bus, there's no spitting, whatever. But I think in the past they were talking about something else. Now it's definitely related to cannabis, among other things.
I think that,
And I know Edwin has his hand up too.
I would just simply state that the goal is to educate and to use that as an opportunity to, make people aware. We want people to be safe if they're going to, do recreational cannabis. And certainly the medicinal qualities are there. They've always been there. And make sure that we make people aware that maybe that is something that could help them with any long-term ailments and things of that nature.
As like they do with cigarettes. Cigarette is dangerous for your health. As they sell them.
Smart consumption is what we want people to be made aware of. And some of these researchers who are already out there doing the work, like Dr. Hurd, play a valuable role in terms of educating people and other researchers. So, I think in our capacity to be able to take information or bring information in and share it in the community is one thing that we can do in a responsible way, because that's our role to educate
as a community board,
board and to address any concerns that people may have around that. I made a note that if we can use it as an opportunity to try to, get information out there responsibly, I don't see why not. I mean, right now, there aren't any illegal establishments. No, sorry. There are no legal establishments in our community as I speak. I think one is supposed to be coming on board, but that might be it in our CB right now. So,
Well, Edwin has a question.
Go ahead,
A
Edwin.
statement, Edwin.
Hi, thank you, Monique, and the work that you and the task force have been doing. My comment is more to, at the health forum, we had an expert on cannabis, and
That's
she
Dr. Hurd.
explained that, yes, and
Yes.
she did a phenomenal job. She explained that the cannabis that people are using today, the one that is even in the market, it's not the one that Bob Marley used to smoke. This one is 300 to 500 times more potent than that one. And she is seeing some epigenetic changes even in the mothers that are carrying offsprings, that are carrying, kids in their wombs. So we still don't know what we don't know about this uncharted territory that we're moving into. And we have to be a little bit, cautious with, what I call a Trojan horse that has come into our communities in the past. We see that communities of color throughout the country, they are, bombarded with liquor store. They are bombarded with cigarettes, with toxins that have not been helpful for our health. And once you become addicted, it is very hard for you to get off of it. And in the presentation, it was shown how addictive it can be for the brain to seek for the cannabis that folks are using today. And, I always go for legalization over the black market, whatever that is that you want to use. However, we must educate our community on the potential risks of the behavior that they engage in, because we heard here before in this platform of CB9 many years ago of how wonderful everything was just for, there was, short of calling that this can cure, HIV. There was this can, help with everything. So I did, went to the task force meeting, and what I told everyone there was that let's remember the opioid epidemic. The opioid epidemic was, catapulted by medical doctors, folks who went to medical school, nurse practitioners, people who have a deep understanding of medicine, yet they were the one who hooked people on these drugs, not because they wanted, but because of the marketing that went around this. And if you had these professionals who were vulnerable to certain marketing, we also have to be just a little cautious so we don't have the next generation addicted to the next, drug that comes into our community. Right now, if you look at the data, folks are drinking less, they're smoking less cigarette, but cannabis is in the uptick. So we have to make sure we educate folks because the rhetoric around this is, look, we all love Bob Marley, right? But that's not the cannabis that people are smoking today. And I think that, education is wonderful to let people know what they might be getting themselves into.
Yeah.
Yes. Was that your comment? Your end of your comment, Edwin?
Yes, ma'am. Thank you.
Oh, okay. No, I agree. I mean, you're right. Education is key. So, we'll work harder to make that possible. That's definitely the goal, while also trying to be mindful to close down establishments that are looking to do harm in our community as well.
And
So,
the thing is, Monique, with that, the harm a lot of times you don't know until many years later, right?
yeah,
When it comes to smoking, you don't know until many years later. When it comes to addiction and the harm that it has brought to our community, many families have been impacted by alcohol,
yes.
marriage being destroyed, kids growing up without their parents because of this. We have to be just cautious of this proliferation of this, of what has been sort of social justice, that we don't become victims again of the next substance in our community.
You're right.
Well, and having said that,
Right.
when the tobacco companies, the whole thing was when menthol cigarettes came about, it's many years, even though those companies knew how dangerous it was, it took many decades before the information was really
Release.
out there and
Correct.
released. And for some reason, it was Black men in particular, Black people, but Black men in particular, who found it sexy. And so the whole thing, that's the doctor at Columbia, the researcher, did her study on that. And there was something very attractive, the feel as it went down the throat, the coolness, as Stephanie talked about this evening, of of it being mentholated. And it's just that they still take advantage of it. And it's just unfortunate, but it's created a lot of problems. And it's going to be interesting when she comes back, Stephanie comes back, when we asked about cannabis, comparing cannabis and menthol, especially since it seems like young people, the teenagers, are the ones that are really pushing the cigarette market, whether it's cannabis or mentholated cigarettes. She said that's where the numbers are high. They get, hooked just about in high school.
That's right.
But it could be that maybe we should produce a flyer or brochure, something that could be online, something we're connecting with YEL, the Youth Education Libraries Committee, maybe something that Community Board 9, just in our area, can put up in our libraries, because we have libraries that are really well used.
And I would add, Laquita, sorry for interrupting.
Youth group. No, that's okay, go on.
For us to also monitor this, because these businesses will come into our community and they would make claims of how much they're contributing back to the community. We have to see the net benefit to CB9, whether this is a positive to our community, whether the overall community is just getting more out from these establishments than what we're putting in. Because if we have these establishments just basically draining our resources, because folks now, they are funneling into the next new addiction, then that is something that we have to be a little cognizant of. We're not against any business. but we have to take the greater health of the community, at hand, because many folks that don't have access to platform like this will not even question some of the marketing that goes around it. When you talk about cannabis, people think that it's just the best thing for pain, that it's just the best thing for Alzheimer's. But what people don't understand is there's just different grades of cannabis out there. And that is, something that you should have a discussion with your individual provider as to which one is the one that benefits you.
Who would know if it's that? What kind of provider? How would they know the different grain? Did you hear Edwin?
We have pain management doctors that they focus solely on pain. These folks are, very educated now in the use of cannabis. Many of them, they also hold their license in
So what
cannabis.
would they do? Give a prescription and they go to a cannabis store? And
Yeah,
that
they can give
cannabis
you they
store.
can give you they can give you a medically graded, prescription as to which one is the one that, based on benefit risk that will, be helpful for you. But remember that these are folks who are monitored by a healthcare provider. So these folks are getting their lab drawn, they're getting their kidney checked, they're having, their liver checked. So they're having access to what the general public would not have access to, because if we have a cannabis shop down the block, again, I'm all for legalization of any illegal substance versus having it in the street. I'm even for having, fentanyl in legalized. Why? Because people are dying. Right now, you go to the street, you don't know what you're getting. So if you have a shop that we can control, is always better than the illegal market. Now, as to how it's going to become about, I don't know. I'm not the person who knows that stuff. But I'm only saying that, these shops that we're going to welcome into the community, for them to also have a sense of, responsibility to the community and not always to just focus on the bottom line.
Correct. I totally agree with you, Edwin. That's certainly something we're very conscious about and will continue to focus on.
You have your work cut out for you.
Yeah,
Because it's really we, but I'm saying you because you were directly there. So these ideas, it's
something, Monique, like we haven't had, in my short time in the community board, close to, 10 years,
Yes.
we have not had a liquor store owner coming and talking to us just about, hey guys, what are the community needs? Yet they are selling liquor in our community.
Yeah.
So
and are
we
we
want to
biggest
foster that for
consumers?
people.
We just think we are.
I would say when, and I know because you haven't been a part of our, and I don't want to like belabor the point, but in terms of the cannabis task force, we have a questionnaire that we send out to those who have expressed an interest in opening up an establishment in our CB. And those questions are pretty extensive. We ask, what are for example, what are you doing in order to monitor, control the line of people who come to your establishment? How do you make sure people aren't congregating when they purchase, that they are continuing on their way because it's just a dispensary. And I know also near the end, we asked a question, how are you going to give back to the community? What are you going to do to help support or educate the community about what you're doing? So that is one of the questions that are on our questionnaire when somebody comes before us. And then and the task force members review the questionnaire, bring the individual before us, and we ask those questions of that potential entity who wants to open up in our community, including whether or not they're a resident. And if you're not a resident, why do you want to open up an establishment here? So we're very concerned about people in the community being used in a way as a front to establish a legal establishment. We want to support people who are from here, care about what happens here, and will reinvest in what is going on. So I want to make sure I stress that, which is why we have the rules and regulations that have been going. We've been looking at and reviewing and revising at almost nauseum, but we want to try to do it and do it correctly along with the questionnaire. So I
You know
want
what?
to share that and let you know that those are conversations we have had, and we're very conscious and concerned about that.
Thank you,
Just
Monique.
1 minute, Erin.
One quickly, I would add, Monique, to that, just so we can tie them back to the responsibility for the community, for them to come, you know, every quarter, or every 6 months to come back to the community board, for them to listen to the health and environmental committee, for them to listen to the, cannabis task force. And that should be also part of your next appointment to get this license, because we want them to know, like, look, we are with you. We prefer for you not only to sell cannabis, you can sell cocaine, whatever you want to, whatever the state legalizes, we're with you, because we don't want people to go to the street.
Correct.
Now, you must understand that we need to have the community best interests at heart and not just the bottom line.
Yes, agreed.
All right. Thank you,
Did you have a
Edwin. Well put.
Okay.
Are you sure? Because I didn't see your.
Because you're new, and so it makes
Dan,
sense.
are you on the board?
Yes.
Oh, I don't know why I thought, okay, well, welcome. You have an opportunity to experience our committee. Did you sign up for this, or are you in the process of looking?
Just
or
sitting
what?
in.
Yeah, I'm just sitting there. And I got
Sitting
an email
in.
about it. I was just like, let's
Check it out.
Yeah.
Okay, well, welcome to the community board, and so hopefully you'll take an interest and be willing to get busy with us.
Absolutely.
Correct.
Absolutely.
And-
This has been amazing.
Are there any
Yeah.
Thank you.
areas of interest that you have? I know you mentioned sickle, but I mean, just in general, what prompted you to join the board? What was of interest to you?
Definitely. So I'm an educator, so definitely like all the things about youth and education and crime, mental health. You guys talk about sickle cell and cannabis. It's something I'm absolutely interested in and very involved in. Not like that.
Yeah.
I'm definitely aware of what's going on.
Well, we have a busy committee. You'll see on the back, the last couple of years since 2022, we've passed 20 resolutions. Because a major part of the community board, role of the community board, is to provide information about the community, to assess the community's needs, and be able to get that message across to our city council, to our state legislators, to the mayor. So they won't know if we don't provide them something. And so there have been a number of issues, particularly concerning air pollution, say congestion pricing, residential parking, these commercial trucks that park and idle. All of that impacts or brings about some component or some extent of air pollution. And
Also, the maternal child.
and then the maternal, infant and maternal health. If you look down the list, we've done quite a bit. The whole thing, noise pollution, pediatric, youth admissions protocols. It didn't come. I was hoping we could get copies, but here's what I'd like to propose before we go. And this was done several weeks ago. As a matter of fact, Edwin, I love the fact that he loves to write. He has these ideas. He has his whole background, public health.
Right.
And so that's invaluable to our committee. And he's produced, a reso on objecting to proposed budget cuts to the HIV program. And so I had that, wait a minute, I did email it to our committee members. I emailed it because I knew we'd have a short period of time. So that one hasn't come right before the committee directly, but that's a resolution. That's number 4 here. We passed the others in committee, but then there's the one on promoting environmental sustainability and public health through increased tree planting and education. So those are 2 that need to be voted on. So, and I believe that I'm pretty sure I attached that, sent it out. I know Heather and Annette got it because we want to work with their committee. And Heather reminded me that you guys, this is a teeny bit different, but you guys, we voted on supporting the tree planting of the 1 million trees. But we need, right now, for some reason, there's a lot more discussion. So maybe it's about to be voted on. So that
we have some statistics that unique to our community board that might be helpful.
I need you to get that. Can you get it overnight? Only because, see, this is June 3rd. I don't know with votes, but it's going to be within a couple of weeks, according to the WEAC people. So what I need to do is once I get Heather's information, and then we'll input it into our proposal. But I know you guys got it because I remember it being late. And I said, we haven't voted on it. Let me send it out to the committee. I'll send it again. And then what's today? Monday, maybe on Thursday, which is June 6th, I believe, or is that June 8th? It's June 6th. I'd like to hear from you. I'll even call. Dan, I guess you won't be part of this because you're just looking at committees. You're not assigned. Or have you been assigned? Okay. So it'll be the 5 of us. Please just look at it. So it could be by telephone, yes or no. Because if this is going to fly, Barry he had suggested submitting it, talking about the HIV programs, opposing those cuts at strategic planning. I got on strategic planning at 7:30. The time escaped me. So was there anybody else here this last strategic planning? Did anyone else go?
No. So I didn't get a chance to go.
That may be why it
and I think it concluded early because it was a low participation.
Yeah,
so it's about that time.
So at any rate, it means that it has to be presented at executive. So that means we need, let's see, 1, 2, 3, 4. 4 of the 5 are here. So I need you to just look at it, okay? And thank you, Edwin, for drafting those. And and don't forget, did you get your public member form?
Yes, I will send it in. Thank you.
Yes, we need you.
Yes.
We need you. And our public members have really been just fantastic. Edwin has been co-chair, but now he's a public member at least for a while. Not too long, I hope. And then Miriam, although she hasn't been she's still active, but she's another one. And then Monica Dula. I mean, we've had some good feedback coming from people who care about health and environment, and they've been active. Okay, and so that is it. So we're done 8:54. And see if everyone, we need to start on time though, like no later than, let's say, 8:35, because if we had started on time, it would at least be 8:45. Right.
Well, it's okay.
Okay, so if someone can adjourn us, if there's no other new business.
So moved.
Second? Who's gonna second it?
Elizabeth? Me, I'll second it.
Those in favor?
Aye.
So at 8:55, actually, we have adjourned. And I also want to thank Elizabeth, but I need you to see, this is the last month before the fiscal year. Those March, February.
And
I'm trying to do word for word.
No, I know. During the week I work, so I started last weekend, and I gotta finish it this. I had my aunt had her 99th birthday, so I can kind of spend
party girl. Party girl. Now, does she have a great time?
No, she's in her bed, but we had company and cake and whatnot. She's 99.
That's still nice.
Yeah. God bless.
Still nice. Yeah.
But I'll try to get it to February.
I need
to March. Or I'll try to get.
It looks like if you do February, March,
let me see if I can get some help.
Then I'll do April and May.
Oh, okay.
And then I got June.
Very quick, let's see what I can do.
Yeah, just a summary. Listen to it and then summarize. Although if there is a vote on anything,
it has to be nice. I know.
You gotta
because I don't have a group agreement.
Yeah, you gotta always have the vote tally. and the time, start and end, and who attended.
Well, I'll
Yeah, you
call
have to do
the
it.
12th will be on. You didn't tell me the time for the 12th. For the
I got it. You know what? I'm wondering if the 12th is a Wednesday. I'm wondering if that Thursday. So can you all look at your calendar and see?
let me
Thursday,
know. Let me know what it is.
Well, that's right. It'll be whatever works.
Yeah, I'll try to make it work. You know, ahead of time.
Okay, Monique, can you be available on the 13th? Should it be possible?
Let me look and see, because I thought we were doing.
Right now, it's the first two media.
The 13th is the day after.
After the 12th, yeah, that's it. It's Wednesday
Really?
the 12th, Thursday's the 13th. I'm gonna try to keep it the 12th. I just gotta do the write-ups, the script, and then I want you all to be able to add, but I wanna make sure, well, Edward's still online. I was hoping I was asking Colin for you. Because we needed copies of, before you go, well, we'll get, that's okay.
So
At
the
this point, I'll
13th?
just send an email.
You said the 12th or the 13th?